Well, good evening. I'm Eric Shadle. I'm the Group Vice President for Mission Integration, and I am so happy that each of you are here. And welcome to our first ever, as far as I know, GHI webinar briefing. And we thought it would be important to offer this opportunity for all of us to learn a little bit more about what's happening in our sites as we continue in this pandemic. But let me just tell you a little bit about myself as we get started here. And the most important thing, I think, is just why I love GHI. I would say my love for mission started as a physician. I did some mission trips. The first was in the Caribbean, and I thought it was going to be a vacation, and it turned into much more than that, and I was hooked. In fact, it changed my whole perspective on vacations. And then when I sold my practice, became a pastor, we went to Iquitos actually several times as a church. And then when I came to Centura, you can imagine how excited I was working with Steve King and Greg, that I was invited to go to Nepal early on in my tenure here. And I've been a big supporter and excited to be a part of the team with GHI. But right now, I want to introduce Greg Hodgson. Many of you already know Greg. He's the founder of GHI, but let me just brag on him for a couple minutes here. You know, he has extensive experience in international travel, project management in over 30 countries. He's lived overseas. He has a graduate degree in international relations from Johns Hopkins University. He speaks several languages, but I'll say that my experience with Greg is that he's unflappable. I think that's the word I would use. Nothing seems to rattle this guy, and so I love traveling with him overseas. It doesn't matter if you arrive late in Lima at 1 or 2 in the morning and your transportation that had been arranged is not there. Greg, without any concern, finds transportation for everybody. Or a broken down Jeep in Nepal, up in the mountains, and like, what are we going to do? And somehow everything works out just fine. Or taking a wrong turn in Belize and ends up being a wonderful sightseeing trip. It took us a little longer to get there where we wanted to go, but it turned out fabulous. So I just personally really admire and enjoy working with Greg, and I want to welcome him to the floor and give us some updates from his perspective right now.
All right, well, thanks, Dr. Shadle, and good evening, everybody. Thank you so much for joining us tonight. This is a new experience for us, and hopefully this will be helpful for you as well to understand more about what GHI has been doing. So we've certainly been busy, even though the pandemic has really, thrown a wrench in the works here. As we've been working with our partners overseas, we've tried to find ways to continue the mission that we have. And as you can imagine, without having teams going to these countries, it's changed the way we do our projects, but the mission is still there. And so I want to give you a few examples of what's happening in our partner countries. So one of the biggest questions, of course, I receive is about COVID, how that's impacted our partners. And so I want to start with that. I will say in my many years of experience overseas, COVID has really been a challenging situation for all of us, not only here in this country, but it's impacted the world in ways I've never really experienced before. So let me start with Peru. Many of you on the call this evening are familiar with our partner there, Clínica Adventista Anastal. they have really suffered through this pandemic. It hit early and it hit hard, and about 75% of their staff were sick in April. And by the end of the month, Dr. Milka Branjes, who many of you know, the director of the hospital there, and her team decided to close the hospital. And it was a hard decision. Milka wrote to me and she said, you know, it was the hardest decision she had to make in her life. She cried bitterly after having to do that, knowing that, you know, people that had COVID would need care. The government did designate the regional hospital for COVID patients, but it was a very difficult time. 75% of the staff were sick. They couldn't staff and maintain the services there. So for the month of May, the hospital was closed. And as you can see in some of these photos up on the screen now, they were put into action just trying to get their own staff back into health. Immediately, GHI sent down some funds so they could purchase PPE, which they didn't have enough of. They were able to get that through Lima, even though it was quite expensive. And then we were able to ship some PPE from Denver in partnership with our hospital in Florida. And it went by truck from Denver to Miami, and then flew from Miami to Lima, and then on to Iquitos. Unfortunately, some of the staff died during the pandemic, 2 physicians on staff and 1 nurse. The picture that you see on the right side, at least in my screen, is Alex. He was a radiologist technician, and he was really sick for many weeks, was in the ICU on a ventilator, but I'm happy to report that he did recover. He's back at work today, and the rest of the staff are back as well. By the beginning of June, they started opening a few services, such as the pharmacy and imaging. And by the beginning of July, then most all services were back up and running within the hospital. Unfortunately, it took a grave toll on their finances, as you can imagine, being completely closed for a month and then only partially opened during the month of June. So they've been struggling financially, but things are slowly coming back. The biggest challenge that Milka has right now is staff. She doesn't have enough nurses and physicians to really care for all the patients that are coming into the hospital. In Iquitos, they've done some surveys since and said that probably about the same percentage, about 75% of the population had COVID. It seems there's a bit of herd immunity there now. And so she's not seeing many COVID patients coming into the hospital. They're seeing some of the typical diseases that normally are seen there in the jungle. So dengue has been peaking, as well as some other mosquito-borne diseases. We also sent money early on to help them convert the chapel, which is on the grounds of the hospital, into a COVID ward. And so they've started recovering. Peru as a country has gone through different phases. Initially, Iquitos was the hotspot. Later, it gravitated to the south, to Cusco, to Arequipa, and Juliaca, and in Lima as well. We've had a lot of problems. And overall, I've seen some statistics that probably Peru was the hardest hit country in all of the Americas when you look at the percentage of patients who had the pandemic. So let's now move on to Nepal, a country which wasn't as hard hit, but we don't have as good of information there. Initially, they didn't see many COVID patients. The government had designated a hospital in the near area in Dulikhel to be the COVID hospital. And so any patients that did have symptoms, they moved on to the Dulikhel hospital. But over time, there started to be more patients. They didn't see as many patients initially at the hospital. Again, people, just like in this country, were nervous about going into any hospital, thinking that they may become infected. And so patient numbers decreased during May and June. They started to pick up a little bit in the middle of the summer, and we're getting back to 70, 80% of normal. And then as the cases started to rise again, the government declared that all hospitals in Nepal were going to treat COVID patients. And so they started seeing more patients now at Shir Memorial Hospital, our partner there. But again, the overall patient numbers dropped significantly, and so they've been struggling financially, just as in Peru. I talked with Dale Mole, the CEO, on Tuesday this week. They still have COVID patients. There we again sent funds, soon after the pandemic began, to help the hospital so they could purchase PPE. There they have resources in India, which could get that material to them quicker and cheaper than what we could provide. And so we just sent the funds for them to do that. And also we helped them to turn the chapel on the grounds of the hospital into a COVID ward. So things are a little bit better there than in Peru, but again, in Nepal, you don't really know exactly what's happening. Testing is not as widely available. The reporting of COVID cases isn't as accurate as Peru has been. And Nepal is always a bit of a challenge within their government systems anyway to be able to understand what's happening. The other country, which really didn't get impacted as much, was our partner there in Rwanda. So Muganero Adventist Hospital didn't actually even see a COVID patient until September. The country had very few cases. The few that did exist were in the capital of Kigali. The government came down quickly and forcefully and putting in restrictions. They closed all the schools. They set up blockades, so travel was difficult through the country. And they were able to control this pandemic probably better than any other country in Africa. And in fact, have done much better than most other countries. They were able to travel to Europe, for example, if they had the means, whereas we as Americans were not and are still not able to travel to Europe. The government in Rwanda also continued to provide financial support, so that helped the hospital to function well. When I talked to one of our partner physicians there, Dr. Albert Ralima, he gave me the example. He said, we Rwandans, we're used to following rules and listening to what the government is telling us. Whereas you Americans, you are so independent, you don't like to follow rules, especially what the government tells you. And look what's happened now. You guys are really struggling with this pandemic, which I guess there is some truth to that. So through all these experiences in our partners in this pandemic, we've seen how it's impacted in different ways, what they struggle with, especially in Peru and Nepal, not only with the illness, but also the financial challenges. But we've been able to continue to maintain contact with our partners, to send resources where we can. But we've able to also to continue some of our programs, which are ongoing. And I'd like to now direct our attention to some of these projects, which I think are really exciting and something that we can continue to support, even though we can't travel at this time. So starting again in Peru, we have a project there called Salud Total. Most of you are familiar with this, where we embed university students in some of the communities along the rivers. We had to postpone and shut down the projects during the peak of the pandemic, but luckily things started to open up. And in these photos, you can see some of the students who came back and are now working in the community of Sinchikui starting in September. So they've been a little over 2 months now, again, focusing on health education and prevention, especially around anemia for small children, which did get much worse during the pandemic. And as we've been hearing actually a little bit this week, there are definite mental health issues that are created through the pandemic. And they've experienced that too. I talked with Natalie, who's our project director there, earlier this week, and she said that, about 75% of the population there in the community had COVID. At least they think they did. There was no testing. There was no real access to healthcare during that time. She said that the people just turned to natural remedies. They went into the jungle and collected different types of medicinal plants and used those in their cooking, or they boiled those plants and just breathed in the vapors. And luckily, no one died, but there was definitely a big setback for the community as far as overall health, as far as how the kids were being handled since the schools were closed. And even now, it's a challenge, to try and keep the kids busy there and to keep them active. So we're very delighted, as is the community there and the leaders of the community, that these students can be back working with the community members, going into the schools, helping in the homes, and doing different programs to improve the health of those communities. Another project we've been trying to work on and get started is a project we've talked about for years but haven't really been able to pull together. But that is to provide an ongoing program for cataract surgery. For those of you who've been there and have gone to some of these communities along the river, you know that cataracts is a very common problem and one that does need attention. And so what we'd like to do is to start a surgical program, which doesn't necessarily rely on us, but can be done by the local providers there in Iquitos, and that we can just provide the financial resources that they need for the local doctors and nurses to perform these surgeries. Another place where we've been providing that type of free surgery is in Rwanda. Many of you are familiar with this program as well, where we're helping kids that have clubfoot. And here you can see some photos of kids who have come into this program. We're really excited that recently we've been able to increase the number of children that we're able to help through this project, and many of you I know are even donors to this. We have a new staff member, Paige Steele, who's going to be talking with us a little bit later in this program, but she's brought some new ideas to this and has reorganized it. So we're really pleased at the number of children that we're able to help through these surgeries there in Rwanda. Another country where we want to provide these ongoing surgeries is in Nepal. We've been working there for several years already and providing surgeries for women with uterine prolapse. And we want to continue that. Again, not necessarily having to send teams to do that, but we can provide the resources through donors to provide those surgeries by using the local surgeons and nursing staff. Right now, when I talked to Dr. Mole, the CEO of the hospital there in Nepal, he said women are still nervous due to COVID about coming in for an elective case. But as things calm down a little bit, they want to start bringing in, again, groups of women for this important surgery. So those are the ongoing surgical projects which we are working with and trying to gather donors to support. Some other things that we've been doing that have been very effective. One is our programming around mothers and children. So many of you know, again, about helping babies breathe and helping mothers survive. These are some great programs that, again, are being used in each of our countries. And Dr. Watson, who's been helping with that program, is going to give us a little bit more detail about that in a minute. Another area which we've been helping is with medical equipment. So we've been gathering supplies over the last few months, and we were very busy last week, actually, trying to get a new container filled with equipment for Peru. And so we were able to get this loaded mainly on Thursday last week. Here's some photos you can see. Got some new stretchers for them, which Milka is really excited about. Lots of metal shelves. So you can see those are the boxes at the back of the container there. And they're excited to get those because most of their shelving in Central Supply are all wooden shelves that are being slowly eaten away by termites. So the CFO there, Cesar, he's so happy to get 60 new metal shelves there. Had to make several runs to Costco to get those. And in the back of the shelves in the middle photo, at least you can see some pediatric beds that are in there. Other things that we've sent are surgical tables and medicine cabinets, lots of training supplies for helping mothers survive, other tables and equipment for the ORs and for patient rooms. So that's currently on its way to Los Angeles, should be put on a boat and leave for Lima on Sunday, this next week, and arrive in Lima the first part of December. At the same time, we've been gathering some equipment for our hospital in Rwanda, and there we're planning to build a new maternity ward. And so there are several items that we need to ship there, things they can't get in country. Not only medical equipment, but also building supplies. So things like vinyl flooring and doors that are really good quality and beds, things like that they'll need. So to sum it up here, I'd just like to say that our mission continues in helping our partner hospitals around the world. But these projects, again, rely on the generosity of people like each of you. And we're just so grateful for your support and for your help, which helps us to continue to live out this mission. So now I'd like to turn this over to Dr. Watson. Many of you know Dr. Watson. He's been with us for several years helping with GHI, but serving for many years within Centura as an OBGYN, many years as well as the Chief Medical Officer for CHPG, the physician group within Centura, as well as the CMO for GHI. Currently, he's coordinating all of our mother-child programs. And so, Dr. Watson, I'll turn it over to you now to give us an update on what's happening with those projects.
Great. Well, thank you very much, Greg. And thank you to all those on the phone and the webinar tonight for the opportunity to be able to share a little bit about what's going on with maternal and child programs within Global Health Initiatives. I too, like Dr. Shadle, am an OBGYN physician, as Greg has indicated. And my first experience with Global Health Initiatives was about 9 years ago, where as a clinician, I traveled to Nepal to do uterine prolapse surgery. That's where I caught the passion. This happens to be a picture a couple of years later where I was continuing in my clinical work, and I was blessed to be able to take my daughter with me. That's Nicole, my youngest daughter, off to the left. And such an impactful opportunity to be able to also have our family members occasionally be able to participate in some of these medical mission trips with us, and to be able to see the world and see how other cultures interact with medical care. So a very special moment for me. As I said, I've been working with GHI for about 9 years now, continuing my efforts with the clinical efforts, and then eventually migrating into some more leadership efforts, as Greg has indicated as well. I'd like to talk a little bit about a couple of the programs that we are now utilizing and working with. Some of you have heard of Helping Babies Survive. We are utilizing this program in all of our countries and has been ongoing for a few years now. Some of you may know, but neonatal mortality in our partner countries can be up to as high as 3 to 10 times higher than it is in the United States of America. A program called Helping Babies Survive was developed through the American Academy of Pediatrics and the World Health Organization. That is a simple train the trainer program, where simple rescue techniques can be utilized by birth attendants to help rescue babies that are having difficulties, especially with breathing, especially during that minute right after birth, that golden minute right after birth. This train the trainer program, where we're able to train those skills, supply some basic materials, can then be shared with other birth attendants. So in other words, we can scale that to a larger and larger degree across the community to be able to help for sustainability of this particular skill set. We are able to supply some necessary equipment with it as well, as you can see here, mannequins to help to practice these critical skills and training materials, bag valve masks, as you can see there on the left, to be able to practice suction materials, etc. So it's been a highly impactful program. We have seen impact as much as a 50% decrease in neonatal mortality in those areas where we've been able to share these critical techniques and training programs. So very, very valuable, very, very desired by our partner countries. However, we also know that at the time of birth, there is a second patient that is present, and that is certainly the mother. And the mother's at risk as well from complications surrounding the birth process. GHI has embarked and embraced upon another program, which is a train the trainer program that's called Helping Mothers Survive. And similar to Helping Babies Survive, this is a train the trainer program where basic rescue techniques are trained to birth attendants to help to impact the #1 cause of maternal mortality across the world, which is postpartum hemorrhage. Postpartum hemorrhage. Maternal mortality is anywhere from 20 to 30 times higher in some of our partner countries than it is in the United States of America. So a very important set of skills that are necessary by these birth attendants to be able to help to impact that. This program called Helping Mothers Survive was developed by the Johns Hopkins Program for International Education and OBGYN. And we're just starting to roll this out in some of our countries that we participate with, but it's very important and very important to help these babies also have a mother. So quite critical. So as we continue to move forward, the international effort now is trying to combine these two critical programs into one, because so many times there's a single birth attendant that's present at the time of birth that has to take care of potentially two very sick patients, the baby and the mother. So these two programs, HBS and HMS, are being now integrated and intertwined so that we can train those birth attendants to understand how that they can balance and they can manage potentially two patients at the same time during a very critical time. And this is what we call couplet care. This is what we call couplet care, which is managing and taking care of the baby and the mother, the dyad, at the same time. Now, as Greg has intimated to you earlier, COVID has been quite impactful for this couplet care education, as well as just neonatal and maternal mortality overall. Everything that I've talked to you about so far has been statistics and information from prior to COVID. We have some early indication that because of COVID, we have seen an increase in neonatal and maternal mortality as high as 50% higher than it was prior to COVID. And this again is because people are afraid. They either have difficulties gaining access to get to the hospital, or they're fearful to even go to the hospital. So this just tells us how we need to continue to emphasize and help our partner facilities to continue with these programs so that we can help to mitigate some of the increasing problems that we see with neonatal and maternal mortality, certainly in this era of COVID as well. So where are we going as we move forward? As we move forward, I kind of focus on three big areas that we need to really, really make sure that we are managing well. The first and most important is we need to really focus on supporting a local champion in each of our partner sites that can help to push these programs forward, this couplet care program forward. They live in the community. They understand the cultures. They certainly speak the language, and they understand how to keep these programs moving forward. So helping us to be able to support those local champions in those local communities are a critical aspect of how we're going to be successful keeping this program going forward. We also need to continue to integrate and collaborate with the local health departments, the whole local health ministries, to make sure that their vision and how they're managing maternal and child health continue to be supported with our efforts, so that we make sure that we are adding to their success. And lastly, we need to make sure that we are continuing to support the local nursing schools with couplet care, integrating this curriculum into the teaching of these nursing schools, so that when the nurses graduate and they go into the community to practice their skills, they have these critical skills available to them to make sure that they're continuing to sustain this successful program. So finally, what am I asking of you guys? What I'm asking of you very humbly is that hopefully we can get some financial support, especially for these local in-country champions that we have, to make sure that they continue to support these programs as we move forward. And I would also suggest that once we get past some of these terrible times of COVID and it's safe, to maybe consider traveling to some of these sites. The only way that you truly understand the impact of couplet care and these programs that you're so graciously supporting is by touching, seeing, and feeling them. So going to these sites is really going to be critical as we continue to move forward. And so with that, I'll turn it back over to Dr. Shadle, and I'll be available for questions as we get further along here in the program. So thank you.
Thanks so much, Dave and Greg, both for your updates and the insights that you give by the experience that you've had in these countries and even during this pandemic. Now we have a time for Q&A, and thank you all for submitting questions in advance that we're going to be answering in just a minute. But I just want to invite you to feel free to write any new questions in the Q&A box, and we'll be sure to get answers to you in follow-up email format shortly. But our first question is for Greg, and I think it's a great question that we all have. So Greg, when can we travel again?
Oh, yeah, you're asking me that. Well, I'm the one that's been asking that for months. I tell you, this has been the longest time since, I don't know, I guess since I was in college that I haven't been able to travel. So it's been a challenge for me just to be sitting here in Colorado, thinking about all those things. Even my daughter has moved over to Hong Kong, is teaching there, teaching math to a middle school, and I'm pretty jealous that she can be overseas. But obviously, you know what I do at this point. You know, we are not advised to be traveling internationally. It's interesting to see now. I can notice that in the Southern Hemisphere, that some countries are starting to open up a little bit more as COVID cases are decreasing. So when you look at Argentina, Chile, some Southern African countries as well, they're starting to open up because it's warm there, it's their summer, and so they're seeing a decrease in cases. But here's what we know, of course, is that you know, vaccines are being rushed through the process, and heard a lot about that this week, in fact. So we hope that something's going to be coming available here in the next few months. We'll see how that goes and what requirements then these host countries may have as far as letting tourists back into the country. So our hope is that we'll be able to start to travel again next year. Tentatively, we've put out a schedule for some trips starting in June next summer. But again, we'll just have to wait and see how this pandemic plays out. Mm-hmm. So great question. And I wish I had a more definitive answer, but at least we're starting to see a light at the end of the tunnel.
Yeah. Well, thank you, Greg. I wish we all had a definitive answer on this, but the next question's for Dr. Watson. I'm just going to read this question. It says, I've been hearing some about the renovation of the Muganero maternity ward. Can you give us more detail around that and how I can get involved?
Sure. Well, and good question, by the way. So the maternity ward at Muganero, as many of you maybe are aware, Muganero Hospital is in the western part of Rwanda, and it serves basically as a referral hospital for sicker patients. Most of the deliveries are done in the local health posts in the regions around Muganero, but the sickest of the sickest get referred into the hospital there. The maternity ward is, shall we say, quite dated, very inefficient, and safety is a concern in my mind when I've been there, obviously. So we have been working with local leaders there at Muganero to redesign a proposed revision and refinishing of that particular ward, to be able to have an NICU in place, to have new delivery suites in place, and to really make it more efficient and safe, higher quality, and I think it'll really serve well. By the way, we are very fortunate, and we are having right now, and we're in the middle of a Christmas appeal, I believe, and Paige will probably bring that up, where we're trying to raise funds for that maternity ward revision. And we are very blessed that we have one particular donor who is committed to having matching funds. So for every dollar that is donated during this Christmas appeal, there is a matching dollar up to $25,000. It's pretty remarkable. So I really hope that that's successful, because that maternity ward really is in need of revision, and it serves such a large referral base of all the sickest of the maternity patients. So hopefully that answers your question.
Yeah. Yeah, thanks, Dave. I can also say that they are in dire need of a renovated ward there. Greg, the last question is for you. I'll read this one. It says, to Greg and the GHI team, how will GHI re-engage in our in-country partners to better understand local post-pandemic healthcare priorities and inform our future initiatives?
Yeah, good question. Obviously, things have changed over the past 9 months, and will change a little bit more until we can travel again. So we want to be very deliberate about re-engaging these projects, sending teams to these countries. So as I said before, hopefully we can start having teams travel next summer. But before that happens, we want, want to make site visits to, to discuss with hospital leaders on site, what's changed, what new regulations has the government, has the government instituted, what's the general safety of the country, are there new priorities, even talking with the folks there in Iquitos, said, we can't do it the same way where we've got, 30 or 40 surgical patients coming in on Sunday and all being together, that'll have to be spaced out, that they'll have to figure out a different way to admit patients and to take care of the families. So I don't know, there's a lot of unknowns. So what I can say is this, is that, we want to be very cautious about sending teams again, that we're going to be studying this in more detail over the next few months as this vaccine starts being laid out, and that we want to come up with a very strategic approach to re-engaging and sending teams. So we are getting, of course, requests from all of our partners, when are you guys going to be able to come back? We want you, we need you, but just want to make sure, though, that we re-engage in a safe and strategic way before we start sending teams again. So hope that answers the question.
Yeah. Sounds good to me. Thanks, Greg. Appreciate that. Well, at this point, as we wind down, it's really my distinct pleasure and privilege to have the opportunity to introduce Paige Steele, our new GHI development officer. When Kim Kennedy announced that she'd be leaving, I don't think I was the only one who thought, man, this is going to take a long time to find somebody to replace her, because it takes a really unique skill set and passion for this position. And, someone who's comfortable in foreign countries, understanding cultures, how to connect with people and connect them to their passion for the mission. But Kim told us about Paige, and we got to know her and interviewed her, and Kim was right. Paige has been a terrific addition to the team. She's already built on Kim's success with the Clubfoot sponsorship program that was mentioned earlier this evening. And so it's my privilege right now to introduce Paige to you. So Paige, tell us what you're thinking.
Thanks, Dr. Shadle. Hi, everyone. It's so good to be here with you guys. Like Dr. Shadle said, my name is Paige Steele, and I'm the new development officer for GHI. And I am just absolutely thrilled to be here. It's kind of crazy because I actually met Kim in Rwanda back in January when she was wrapping up leading a GHI trip out there. And I was there with my previous employer, and Kim and I just really hit it off. And I just remember even then thinking like, oh my gosh, like she has a dream job, and thinking, oh, I could do something like that maybe in 20 years. And it ended up being a few short months later, in fact. So it's just crazy how everything just works out in God's timing sometimes. But anyway, on to more important things. We are so grateful for you guys for being here with us tonight. It means so much to have you guys all with us in our very first GHI donor briefing. So thank you for everything that you guys have done over the years. I can see everyone that's attending tonight, and I know I've met each of you already personally. And so for those of you who aren't here personally tonight, I'm looking forward to meeting you guys sometime here soon as well. So just thank you again. We will be sending out follow-up emails tomorrow, and so you'll receive that message from me here shortly. And it'll just, have some more information and just asking how you guys want to further get involved in some of these projects that we talked about tonight, like the maternity ward in Rwanda is a big one, especially with that match that we have right now, as well as total health is always huge, and Clubfoot, and just here to answer any questions that you guys might have as well. So anyway, we also feel like we've had such a great response for this, so we want to keep doing these. So we are going to probably schedule another one in the next, I would say, like 4 to 6 months, and just continue to keep you guys looped in. And then if you have any questions between now and then too, of course, we want to hear from you. So thank you guys again so much for being here with us tonight. It means so much. And thank you again for everything that you have done for GHI over the years.
Yes, let me just close with prayer and add my thanks to everyone for being here and supporting through the years. So we really appreciate all you've done. Let's pray. Father, I thank you so much for the grace that you extend to each one of us. And through us, may we extend that grace to those around us. We pray for our partner countries, pray for those on the ground there, and we just pray for your spirit to be with them, that they may thrive and that they may minister to the people in their communities. And may you touch our hearts and help us to understand how we can contribute with the means that we have, time, energy, finances, to be able to support these ministries and your work going forward. So we just leave this all in your hands. We thank you for being with us tonight. We pray in the name of Jesus, amen. So thank you for being here, and good night.
Night, everybody.
Good night. Thank you.